Welcome to This Week Health Community. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week Health, a set of channels dedicated to keeping health IT staff current and engaged. Today we have an interview in action from the 2023 fall conferences of CHIME in San Antonio and Health in Las Vegas. And we want to thank our show sponsors who are investing in our mission to develop the next generation of health leaders. And they are Olive, Rubric, Trellix, Medigate, and F5. Check them out at thisweekhealth.com. And here we go. All right, another interview in action here from the CHIME Fall Forum, and we're joined with returning guest, Kris Nessa. And just like a lot of my other interviews, returning guest, new company.
Yes.
I mean, I know it's been a while since you've been at Tivity, but the last time we talked, you were at UT. And what were you doing at UT?
At UT, I was director of applications, so the whole front end, kind of the physician nursing experience front
So
door.
all the clinical applications?
All the clinical applications.
And you're doing I'm not sure it's a similar role, because it's a very different company.
It is. We're healthcare adjacent, but it is kind of similar. I own all of the success and all of the front door experience for all the products that Tivity puts out. Success
and front door of the product. Well, talk to us. I mean, we've had Sarah on the show and whatnot. Talk to us a little bit about Tivity. That'll set up the conversation.
So Tivity, three core products you could think of. So silver sneakers that have been around for 30 years, Prime, and Whole Health Living. Whole Health Living does a lot of like acupuncture, chiropractic, using data, helping physicians, kind of like, I guess, encourage people to use alternatives to medications and things like that, where Prime and silver sneakers, we encourage everybody to stay active, live healthy, productive lives, fitness and things like that.
Wow, so the application side, you went from clinicians
yes.
Utilizing the systems to now a little different population utilizing your applications.
Consumers first.
Yeah, consumers first. So you are a consumer-centric organization,
yeah.
And it's seniors.
It is. Primarily, yes, primarily. We do the Prime applications 18 and higher, but yes. What's funny though, I was thinking about this actually during one of the sessions, and where I've sat before, so I worked at Cerner for years as well. And it was one of the things that, like Neil Patterson, and even working at the Cleveland Clinic and talking with Judy Faulkner, we still had it ingrained in our brains that the patient, the customer was first, even though we were building applications for the physicians and nurses. Same thing at Tivity, customers first.
It's customers first, but consumer versus a clinician is very different.
It is.
Because with the clinician, you get to have conversations on an ongoing basis. They're more than happy to tell you how the system is not working for you. How do you get that kind of feedback from the consumers?
Well, we do polling, so you can do email, video chats. We actually engage with them and have like real-world conversations. And one thing, at the Cleveland Clinic, we actually did this on a monthly rotation. We brought in patients and had them talk to us about their experience at the Cleveland Clinic, which helped us augment even operations in our portal and things like that.
So what kind of applications are actually touching the consumer from a Tivity standpoint?
So the silver sneakers application itself, so the 65 and plus crowd, the Prime application, and Prime sometimes is rebranded because we support the physical activity and networks for, let's say, Walmart, HCSC, Fitness Your Way. It might be rebranded, white labeled on the front end.
So when you talk silver sneakers, tell us about the silver sneakers program, because I want to go into that a little bit.
So yes, 65 plus Medicare Advantage like benefit that you can add that's usually available through your health plans. And our goal is to get people active, take care of their physical health, their mental health, and even like connectivity, just connecting to people in person and even virtually.
So talk to me about the development. So we're at a point where health systems are starting to do some development. For a long time it was sort of like, you know what, EHR can do that, this can do that. We'd let third parties really do that. But more and more are stepping into this. What's the, for lack of a better term, what's the DNA that's required for an organization to adopt that sort of agile creating of applications? And it's not really creating of applications, it's really adding features in an agile way as you move along.
I've lived a life cycle throughout my own life. And one of the key things is understanding the C-suite's even idea or intent of having that business unit. because some of them have different mindsets or intents. I've been one place where they wanted that team to create applications that actually generated revenue for the health system. And that puts a different target, KPI, metrics on your back, where a different organization might just want to augment the EHR, augment any gaps we might have in operations and true up any inefficiencies and streamline this. And that has different meaning, different intent, and different metrics to hit. So understanding that first can really help guide how your team is formed, what your strategy is, what you need to focus on, so that you're meeting the goals and expectations of your seniors, of your boss.
We had GM Bruno. Is David?
David Jean Bruno.
And we all call him G, so that's why I forgot his first name.
G. They call me Nessa. There's a lot of Chris's, so there's G and Nessa.
G gave me a great quote, and it was, it only took God 7 days to build the world. You've probably heard it, because he has all these quips and stuff. He said, because he didn't have to deal with legacy.
Correct.
Do you have to deal with a lot of legacy?
Yes.
Unfortunately. Unfortunately, you do.
There's the curtain. Yes, yes. We do. And so Silver Sneaker has been around for 30 years. So much like CHIME, we celebrated our 30th anniversary in September. And it was great. We did a YouTube, Facebook Live. We had live classes with our instructors and everything like that, and it was great. But over that time, if you're not investing in the technology, the things that you need to run your business,
right,
you're just kind of putting Band-Aids on it.
Well, 30 years ago, was it a technology that they were doing?
They would have told you no. They would have been like, yeah, we're Access, we're a gym network company, we kind of do this. But as we've all evolved, if you truly strip all of us out, the technology that run these businesses, they wouldn't run. I mean, I still love Walmart's CEO when he was on Squawk Box or something over a year ago. He said, we're a technology company first.
Right.
And it's I'm just telling everybody else that, none of us would be around without technology to help DevOps, FinOps, all the ops. How do we operate and become efficient, effective, and deliver our value to any consumer?
Drex DeFord tells the story of when he was at Scripps as a CIO, he made that comment. He goes, we're a technology company that happens to deliver healthcare. And he goes, they weren't ready to hear that.
Right?
Back then. No, he's been out of Scripps for a number of years, but so you go back about a decade and a half when he's making that comment, it really is true today. I mean, it's almost impossible to create the experiences we want to create for the patients without technology, and to improve quality of life, and all those things. But with it also comes the complexity of technology. You're dealing with, I keep coming back to this, you're dealing with seniors. There's this misnomer that seniors are technology averse and those kind of things. Mm-hmm. Disprove that. I'm a skeptical board member. Disprove to me that seniors are adopting technology and know how to use the kind of things that you're trying to roll out.
Absolutely. I think it's just a human mindset. So my grandfather-in-law is 85, uses his iPhone so efficiently. He texts, he calls, he FaceTimes, all of it. Whereas my own parents, who are 15 years younger, early 70s, my dad and mom I just know what I know. You need to fix my computer.
Here, let me call you from the rotary phone that's still on the wall.
So I think it's more of a mindset. And also, if you think about it, that baby boomer generation is ready and on the heels and already entering my 65 plus core market. And they know technology. They know how to use Amazon, and they expect that same type of interaction, customer experience and service, and they're ready for it.
All right, we're going to be doing webinars a little different this year. I've talked to you a little bit about this. We got together with our advisors. They told us, hey, you got to do them different. They're just not serving the community well. And we said, what do you want? They said community-generated topics, great contributors, not product-driven. They want a more honest and open discussion. And they said, what we want is no on-demand webinars. We want once-and-done type webinars on a consistent date and time. So every first Thursday of the month, our first one being January 5th, first Thursday of the month, 1 o'clock Eastern time, we are going to be doing a webinar. You can count on it. Put it on your calendar. Every first Thursday of the month, at 1 o'clock Eastern time, we're going to do a webinar. The topics are going to be generated by the community, and we would love to have you there. Our first one, January 5th, priorities for 2023, a CIO discussion with integrated delivery networks. February 2nd, we're going to come back with academic medical center CIOs talking about their priorities. And then we're going to hit some of the other great topics that they've given us for the year. And we would love to have you join us. Again, thisweekhealth.com, top right-hand corner, it'll have our current webinar and our upcoming webinars. You can sign up right there. And if you miss it, it's not on demand anymore. So we would love to have you there. Make sure somebody from your team is there taking notes and bringing stuff back to your staff. So we hope that this works out. Any feedback, go ahead and send us a note. We would love to hear about it.
Yeah, I think we all have those anecdotal stories. My father's 87, just got his first iPhone. And now it's a hand-me-down from my mom, who's been on an iPhone for probably 6 or 7 years, because she had some friends and they used to like, oh, you look, I could take a picture and send it to whatever. And then the pandemic, I think, just accelerated all of it. And now what's accelerated, my father, the reason he got a phone was the cost of a landline, for whatever reason. He's like, he calls me up and he says, hey, look at this bill. I think I'm paying $75 a month for a landline. And I look at this bill, I'm like, you are. That's insane.
That's insane. That's more than a Verizon or an AT&T cell phone.
I know. And I'm like, look, you qualify for the senior plan. With you and mom, it's going to be $60. He says $70. All right, so now you have a whole population. What's the potential of really helping that population with technology now that they have, through the pandemic, have really adopted technology?
It did. So Tivity did have to convert, obviously, during the pandemic. We had a lot more virtual classes. They had to stand up virtual atmosphere pretty quickly, like some of the healthcare systems did. But there's a drive, there's a need for it. And honestly, one of the actual big Tivity announcements here, maybe a week or so ago, we've been working with Apple. So Apple Fitness is expanding and growing. And as a part of it, Apple worked with us at Tivity, so Silver Sneakers, Target, United Healthcare, and I think Mobile Health, so 4 strategic partners to offer Fitness Plus, like at a discount or free to those customers and members. And it's been a great experience to work with Apple. And even though it's not going to be like a big, probably engagement tool, just that marketing presence, getting it in front of people, reminding them of Silver Sneakers been around for 30 years, or hey, you're 55 or 60 and maybe you haven't heard of us, but you know Apple. Here we are. Here we are.
Great branding, by the way. Silver Sneakers is great. What are you looking to get out of the conference?
CHIME is like family. It feels College of Healthcare, so it feels like college and family. It's just great seeing everybody connecting.
Well, CHIME actually is college.
I know. So it's like, but yeah, just reconnecting with everybody, having conversations, having a coffee, and just talking shop, talking life, talking how can we help each other, really.
It's great to connect again. That's what this is all about, right?
Exactly.
Kris, thank you. Appreciate it.
I appreciate it.
Another great interview. I want to thank everybody who spent time with us at the conferences. I love hearing from people on the front lines, and it is phenomenal that they have taken the time to share their wisdom and experience with the community, which is greatly appreciated. We also want to thank our channel sponsors one more time who invest in our mission to develop the next generation of health leaders. They are Olive, Rubric, Trellix, Medigate, and F5. Thanks for listening. That's all for now.